I want to know, what are some pieces of advice that you can give to dentists listening right now to help us tomorrow manage anxious patients? Because anxious patients, phobic patients can be a blessing in terms of, they're patients for life, so rewarding, the great feelings that you get, the hugs that you get, the lives that you can change. But they're also the reason you run 45 minutes late. You have to get the tissues out and give it to your patient. The nurses roll their eyes, all that sort of stuff. They're also, they generate a lot of emotions in dentists.
I think, and you're right, but each of the things you've mentioned there are things that you would address. So first of all, creating an ethos among your practice of caring for the patient, and actually understanding that these are a really rewarding group of patients to help. I think, scheduling them at the right time, good communication with care coordinators, all of those things go a massive way, and it gives everybody, it's not just me that gets the job satisfaction, it's the whole team can genuinely, invest in this and feel like they're part of changing this person's life. So make it a team thing rather than just being about the clinician themselves would be one thing. So ensure that the staff who care around you are also getting the training in communication and sedation techniques and whatever else you're going to offer. I think having time and flexibility would be the second thing. So I would always avoid, if I know somebody is very anxious, I would always avoid squeezing it in. For me, still the hardest patient to manage is a phobic patient in pain squeezed in for 15 minutes. I mean, that is hard, no matter how many NLP or hypnosis courses you've done. That's still going to be very tough, because a patient will pick up on the smallest cues of you feeling under stress or pressure or trying to rush at something, and the whole thing can just spiral and get out of hand quite quickly. So time is really important. And then train. This is one of the things I found interesting when I first embarked on my journey. Dental anxiety management seemed to go in one of two directions. So either you were a sedation dentist, or you did the behavioral, CBT, hypnosis kind of side of things. And actually, I found these two different arms very rarely interacted and talked. It was either the sedation clinic or the hypnosis clinic. And for me, truly to help a phobic patient, it's about selecting the right mixture of all the things that we can do. We've got clinical techniques, injection techniques, learn how to do an Akinosi block, learn how to use computer-controlled injection systems like the wand. Make sure you can get a tooth out. There's very little point in me talking a good game and relaxing a patient and then I can't get a tooth out. So all of that is important.